Why therapy takes so long. It's one of the more common frustrations people bring to therapy, often quietly. Weeks pass, then months. The person understands themselves better. They can name their patterns, trace where certain reactions come from. And yet the pattern is still there. They still snap at their partner over small things. They still over-apologize. They still can't quite rest. If you're used to paying for a service and getting a result, this can feel confusing. A mechanic fixes the car. A dentist fixes the tooth. Why doesn't understanding a problem fix the problem? The answer has to do with what's actually being changed. Most of what brings someone to therapy isn't a single piece of missing information. It's a pattern that formed over years, often early years, in response to a real environment. A child who learned that expressing anger led to punishment doesn't need to be told that anger is a normal emotion. Some part of them already knows that intellectually. What they haven't learned is that it's safe to feel it. And that isn't a fact you can hand someone. It's something they have to experience repeatedly before it becomes true for them. This is the gap between knowing and believing. A person can understand exactly why they people please, trace it back to a specific parent, a specific dynamic, and still find themselves agreeing to something they didn't want to do 20 minutes later. Insight arrived. The pattern didn't move. What tends to move patterns is repetition inside a relationship that behaves differently than the one that built them. A therapist who stays steady when a client expresses anger, session after session, is offering something the original environment didn't. But one instance of that isn't enough to overwrite years of a different lesson. It has to happen enough times, in enough variations, for the nervous system to start updating its expectations, not just the mind. That's part of why trust in therapy builds slowly, and why it should. A person who learned early that closeness carries a cost won't abandon that expectation because a therapist says they're safe. They'll test it, sometimes without meaning to. Canceling last minute, going quiet, waiting to see what happens. Each test that doesn't end in the expected way adds a little more evidence to a case that's still being built. It's also worth saying that not everything takes this long. A specific, contained difficulty, a particular fear, a recent loss, can shift relatively quickly. It's the deeper, older, more relational patterns that take time, because they were never held in place by logic. They were held in place by experience. And experience is what has to replace them. So the length of therapy isn't a sign that something has gone wrong. Often, it's closer to the opposite, a sign of how much the work is actually asking to change. Though sometimes, the pace genuinely does stall. And telling the difference between therapy that's slow and therapy that's stuck is its own question. We'll explore that next.